It's not easy to get a job.
What's the situation like with medical officers in terms of financial security?
If I wanted to become a cardiologist and I wanted to develop my skills as early, I would go and volunteer.
We are on a marathon, starting
Mm.
from medical school, five
Yes,
years, running
marathon.
one after the other.
Yes.
Then after that, immediately you go to internship. You don't have a gap. You don't have time to rest. You don't have time to accommodate.
Yes. So post-internship is different because you have to define yourself, what you want. You're not going to move again in a bunch. The decisions are yours. You have a license to protect. You have a reputation to protect. The law and medicine, it's a different thing. So why you want? My friend is going to do USMLE. My other friend is going for marriage. Now me,
Welcome back to Med Scenarios. Today I'm here with Dr. Tutu Edwards, who is a medical officer and a close colleague of mine. Welcome, Dr. Tutu.
hello viewers. My name is Dr. Edward Tutu, and I'm a medical officer. I work with Chirudu National Referral Hospital, mainly covering emergency department. I'm very happy to be here.
Just to start off, I wanted to get our viewers clear that we are both classmates in medical school, and I really enjoyed the time I had with you in medical school. We had discussions and all that, and now I'm an intern, and Dr. Tutu is a medical officer, and he's here to give us some advice on how life is of a post-intern doctor. So to start with, I would first talk about a little bit on internship. So how is the journey, the transition from medical school to internship in your view?
In my view, medical school itself was a roller coaster, ups and downs, so much to do in little time, and so much to remember because it's a profession. You're becoming a doctor. You have to get all these things, remember all these things because you have to help patients. You don't have to forget all these things.
That's true.
So much more to do in little time. 5 years. Some universities even stretch up to 6 years, but there is much, and despite all this time, you still don't get all
Get
these
yeah.
concepts, finish all these concepts. So after finishing medical school, there is this other part of journey that you have to complete, medical internship. And in my perspective, the transition is rather kind of fast because before you before you get done with the stress of medical school,
Yeah.
you again
Jumping
jumping into another, from frying pan into fire, if that there is that phrase. So usually, the medical, because to get a full license, you need to first complete at least 1 year of medical internship. Um, of course, this medical internship is also not so, depending on the hospitals, there different people have different experiences, but generally internship is not it's not it's not a bed of roses, I should say that, because you're the workhorse. Generally, an intern is the workhorse, is the donkey of the hospital. You're going to do much of the work, much
True,
of the much of the admissions, much of the procedures, much
running
of the
around, making sure
running
everything is
around.
complete,
Yes, making the hospital
functional.
functional.
Yeah,
It's mainly the
mainly.
medical intern. So you're not going to relax. You're not going to sit around. You're going to mind business. You're
That's
going to
true.
see
That's true.
patients. You're going to save so many lives. So it's again another stress that you have to bear on your shoulders. So it's not so easy. You have to just get used. The fact that we've been in medical school, some of the things we learn during our rotations,
Yeah.
so you get used to certain stressors. So it's not so hard, but again,
It's a different game of its own.
yes, it's a different game on its own.
Yeah. But I think that the good thing I liked about internship was that we are this supervised. At
Yes.
least when when we are stuck, we have someone we could go and ask,
Yes.
and there's someone we can rely on from time to time, whether it's on call, using a message or something. But at least there's someone who you can have as a backup where you can ask questions to resolve. But I think as a medical officer, it's a bit different. Is it?
But again, it depends.
Okay.
There are some medical officers that really work in a closed setting. Like you find some medical officers working in clinics, and they are the top
Top one.
most person in the hospital. So they are going to supervise. They're going to supervise the rest of their colleagues. But again, it doesn't stop them from consulting other people above, or maybe referring in that aspect. But again, there are some that already work in settings where there are senior people above, consultants, senior consultants. So there they work under their SHOs. So they work under the SHOs. They report directly to the SHOs and their seniors. So still there is some
So
supervision.
basically, it depends on the setting, which setting you're in. The
Yes,
level
I
of
would say
supervision might
that.
change.
I would say that it depends on the setting.
But is the number of hours different? Like for example, an intern works around 12 hours to 24 hours every day, depending on the circumstances. Is it the same for a medical officer, or is there kind of work-life balance that people strike for?
Um, for I think a medical officer may take less time because generally their the work is may not be so much.
No.
If, for example, if it's in a government setting, you're generally supervising interns, so you're not doing much of the work, and I think you do 3 or 4 duties per week. You don't
You don't do every day like
you
an
don't work
intern,
every
where
day.
you're working 6 days a week.
Yes, so the work is a bit less.
Less, okay.
Mm.
That makes sense. So we can have plans after work, like if you want to go
Yeah, you
out.
can have time for yourself. You can have time for your family. You can have time for your side business. I don't know. Yeah.
I understand that.
Mm.
Um, Now, the other challenge medical interns I think face is about money. It's been a big debate, especially in terms of how much interns are paid, whether they're paid or not, all those issues that we have. But what's the situation like with medical officers in terms of financial security?
Um, Financial security, I would say. Well, it also depends on on the setting.
Uh-huh.
You see, many people would want to work in government because they think the setting is the financial security is a bit somehow stable, and of course, and others engage themselves in doing other on top of the government. They may find them doing other working in other health centers
After their time in the government.
yes after their time in government. But if it's I think it's all about it's not all about having the hospital work. There are other things that you can use to increase your uh, financial
Stability.
stability. Others, depending on how you're saving, some people already save. People are saving internship money, but most people use that money for surviving during the
Survival.
internship
True,
period
true.
because sometimes it's very. Some people find it little, so they
Yeah.
use it for survival.
True,
But
because you
others,
have to consider accommodation,
yes, you
food,
have
and
to consider
everything. You're
accommodation,
traveling far
food,
from home.
transport. Some people who travel, so
Yeah.
it may not survive for long to keep them through the post-internship period. So they have to start thinking. They have to start thinking, where am I going to get money from? What am I going to do? So that is another stress on its own. But again, there are so many other things, non-healthcare related, that you can indulge yourself in to
Maybe
increase your
research.
research. I've seen people doing getting into research organizations, applying and doing research and getting some money
Research.
from research.
I understand. But I think most of these different, let's say there's a diverse set of field diverse set of employments they can get into for getting streams of income. But everywhere they go, they might need some recommendations, because as someone like me who's just getting done with internship, I have no experience in field apart from the internship. I go to a hospital, let's say you own a hospital, and I apply with my CV. You'd be like, at least give me some references or recommendations from someone that, you're doing a good job and we can hire you long term. So how do you go about this issue of references and
Yeah, so generally after internship, the immediate seniors that you have, or the people you know, are your supervisors
yes,
mainly. So usually to get really good recommendations, it starts right away from internship, impressing your
seniors?
seniors. If you impress them very well, they are going to recommend you
So we should
to.
not wait until the internship is over. Now
Yes, you
I'll
should
get
not
serious.
wait.
I'll
You
start
should not
running.
wait. Some of them are actually, if you're really working with a supervisor and you are covering the ward very well, there are no complaints in the hospital about that particular ward.
What?
Well, the supervisor is impressed with you. So
True, true.
he will be really interested in following you up and helping you if you ask for that help.
True.
So it usually starts from impressing your seniors and doing your best in internship, shining in internship period. Um, uh, some recommendations can be got from your lecturers,
Lecturers from the university.
from your universities, where you studied from, like these favorite lecturers of yours, your mentors. So they can help you they can even, some of them own clinics. So some of them can help you and employ you in their clinics for the start.
Even I've heard some people who do research, some of the professors, they might
Yes, some of
ask
the
you to
professors
come in
will,
as a research assistant or something like that.
exactly, some of them will involve you in a research, and you get some money and to keep you busy. Or some of them will advise you depending on your interests, your goals in life.
Right.
They will advise you and make you closer to your goal
Cool.
than anyone else
True.
would have.
Like, for example, if someone wants to become a physician,
Yes,
they would be recommended to go and work in such a setting that will help
where you
them,
find
where you find
physicians.
physicians and all.
Yes, you find mentors.
We have one of our friend, I forgot his name. I think Dr. Isaac. He, we have one of our friend. So he went to ICU and
Yes.
started working with ICU even before doing internship
Yes.
as a pre-intern.
Okay.
And then after doing his internship, he was taking some time off whenever he used to get those days off, go back to ICU, be with the ICU team. And immediately after he got done with his internship, he was
Yes.
able to go back and apply for anesthesia and do a master's in anesthesia, particularly with the ICU team, because they were impressed by him.
Yes, exactly. You follow your goals. If you want to be a physician, then you go and touch yourself to physicians, work with them, get mentored by them, get skills from them, get taught by them.
True,
and then
true.
as you become better and better, they will really recommend you to higher places.
True. And there was another doctor, another example I would like to give you. I went and visited one of the neurosurgeons recently,
Yes.
and he was asking me, has he seen me somewhere before?
Uh-huh.
I told him, you must have seen me in university because I was a student. He's like, I don't remember your face as much, but do you know any of your friends who are with you so that I can recall you? So I
Yes.
took this girl's name who was a classmate of ours.
Yes.
She used to go and spend time with the neurosurgery team in casualty from year 3 onwards itself.
Yes.
And then by the time she was done, they already knew her properly.
Yes.
So
Dr. Rose.
Dr. Rose, when I took her name,
Yes.
the neurosurgeon immediately recognized me also.
Yeah.
So I think it's about making your impressions, like you said, and then looking at what you want to do in the future.
Yes.
But I think most people who are not yet sure of what they want to do in the future, some people take time. Like I would like to personally take time to
Exactly.
decide.
Yes. Some
I don't
people.
want to jump into something and then later regret in the future.
Yes. So in such a case, I feel like definitely you may be having so many things on your mind. You want to do surgery, you want to do maybe nephrology, you have so many things on your mind and you've not yet sieved through which one to really follow. I guess still you need mentors. That's where mentors come in. They will help you streamline whatever you want, whatever you need. Um, to look into the career market and weigh in. Look into, because it's not only about money. It's sometimes about passion. Again, you cannot do something that you don't want just for money. You're
True.
not going to
You'll not succeed as well.
Yes, you're not going to succeed. So you need to have the passion again, and you also need to have, of course, weigh in. Am I getting the money? Am I getting? Yes, it's not all about money again, because you need to love your job, to do it to the best, so that the patients appreciate.
I remember last time we were discussing on how there's some sort of medical negligence or doctors and nurses not taking care of patients as well as they should. I think that brings us back to the passion part of it. If they're not so much interested in doing what they're doing, then it might get difficult to sustain performance long term.
Yeah. You can't. If you're not passionate about, if you don't love what you're doing, you're not going to do it best. And that's where the gaps come in. You end up not giving medication on time. You end up not reviewing a patient because you know you maybe you're tired. You're not in the mood, and then the patient ends up deteriorating, and then all these things come back to you again. So you really need to love what you do and do what you love.
And do what you love. That's more
Yes.
important. That's true. So you're talking to me about mentorship.
Yes.
Now, how can one approach approach someone who could probably be a mentor in the future, or how can one select a mentor in the first place?
So one, usually meeting someone who is familiar with you is
A good starting point.
easier. Like someone who you look up to, someone who lectured you, someone who mentored you, someone who knows you, is usually an easier approach. The other approach could be through someone who
Who knows the person?
Yes, you
Yes.
could go through that. Um, that's another way. So there are so many other ways that
I think some of our friends are trying to send emails on or messages on
Yes.
WhatsApp to these physicians and surgeons to see
yeah,
if they
that
can.
is also another way.
Yeah.
Sending emails to, and then others are doing
Volunteer jobs.
volunteership of in that particular, writing emails to that particular doctor. I really want to work with you. I'm so and so. I'm finished my internship. I would want to learn much from you, get skills from you, and you start from there. You work upwards. You impress them, and it starts from there.
So I heard that after internship, it's very hard to get a job because there's so many doctors around, and most of them are in Kampala. They're all hunting for jobs, and especially with keeping this in mind that there's a backlog of 1,400 interns who are yet to still come in, and then the job market will even saturate further. So is volunteership? Would you suggest someone to go and start volunteering in a particular health center to impress someone, and then maybe continue there down the line?
Well, if you're chasing something, if you, for example, if I wanted to volunteer if I wanted to become a cardiologist and I wanted to develop my skills as early, I would go and volunteer. I would, irrespective of whatever, I would go and volunteer. For example, maybe in Uganda Heart Institute, and I interact with those cardiologists and get more skills. But again, do not forget that you need all these basic needs. You need to maybe get accommodation. It doesn't make sense for you to go and start volunteering and you don't have anything to eat. You don't have a job. You don't have any income source. So you will end up getting. Remember, most of the volunteerships, they do not pay. Well, some of them may have meals, but it's not a guarantee to sustain you through your post-internship life. You need to get a side source of income. It may not be necessarily medical, it may be something else. But again, if you're not going to volunteer all like through the whole day, through the whole week, uh, through the whole week. You'll get some days, and then you probably maybe work somewhere for money, and then come and volunteer and learn. You can do
Dual things.
yes, but again, make sure you balance your duties so that you do not have to affect your other life.
True.
Yeah.
Especially mental health. I think burnout rates
Yes,
are
mental
very high
health.
in these things.
Yeah.
Because I remember as an intern, you're okay, like you said, we are on a marathon, starting from medical school, 5 years,
Yes,
running
marathon.
one after the other.
Yes.
Then after that, immediately you go to internship. You don't have a gap. You don't have time to rest. You don't have time to accommodate.
Yes.
And once you're done with that, then you're again running behind something else.
Another.
So I think burnout rate is very high, especially among interns because
Yes.
of all the workload they do.
Yes.
And what really hurts more is that they stay away from their family and homes, so they have to
Exactly.
take care of everything else, and burnout becomes a bit challenging. So how can someone counter burnout, whether it's during internship or post internship?
Uh, about pardon on the question.
Let me repeat the question.
Yes.
How can someone help counter burnout? Like in the sense, how can they deal with it once they're during? Sorry, let me rephrase it again properly.
Mm.
So how can someone counter the burnout that they experience during internship?
Okay. So, journey from medical school. Actually, journey is entering medical school, leaving medical school to internship, then from internship to post-internship. No one actually prepares you for what is coming for you. So, but moving from medical school to internship, the journey is not so easy. The medical internship itself is not so easy. 1 year of working almost every day. Uh, you get only about 2 weeks rest, I think, and then you go back again to the same marathon. And in some hospitals, you do some people who are working in regional referrals or national referrals experience a lot of patient burden. So the work is too much and the stress is too much. You're bound to forget about your life, to forget about your family, to forget about your health, for example, because you have to impress someone, you have to cover some duty, you have to keep everyone alive. So it's a bit hard. And sometimes the fact that you're going to lose patience, you're going to have this mental, psychological torture that no one prepares you. Sometimes you're living this life like a normal person. When you enter medical school, your life has to change somehow. You have to be the stronger person. Sometimes, even when you're not really that strong, but you have to force things and be strong for the sake of your other patients. And so it becomes very hard life for someone to bear. Uh, Bearing in the back of your mind that you have to survive, you have to make other people survive as well. So it becomes very hard for you. If you do not have family, for example, it's worse. If you do not have mentors to advise you, if you do not have hobbies, for example, sometimes hobbies can take you off the stress. But the worst thing that you can involve yourself is in this all this stress is getting addicted to something, either a drug, alcohol. It's the worst because it's going to make things it's going to worsen your stress and you'll not like it. So do not involve yourself in any form of
True,
addiction.
I've seen people who go into addiction like alcohol and all, and eventually they become suicidal at some point because they're not able to manage anything now.
Yes.
And then life takes a U turn, and
it takes you to another turn. So it's really, really depressing, disappointing, because after medical internship, you know how in medicine, in medical school, everyone you're moving from the same year 4, year 5, then from there all of you move to internship.
Yes.
So post-internship is different because you have to define yourself, what you want. You're not going to move again in a
With
bunch.
everyone, yeah.
You're not going to follow your friend. You may, but the rest is yours alone to run. So sometimes it becomes confusing for you. What do I want? My friend is going to do USMLE. My other friend is going for marriage. Now me, others are going for back to do masters, and then for you, you're stranded. So it becomes again another problem post internship.
So it should be a personal decision. It should be individualized, and you should not compare yourself to others.
Do not compare yourself to other people. Individualize yourself. Write down your
Goals.
weakness and goals, and look. Chase for whatever you want. Do not
do not look into other people's lives.
Yes, otherwise you may be on chapter 1, your friend may be on chapter 20.
True.
So if you start comparing, you're going to become confused, disappointed, and you might jump out of the medical field.
That's wonderful advice for those who are completing internship.
Yes. Yeah.
But does the burnout decrease after internship, or does it still remain the same?
It depends also still.
Okay.
The burnout may increase, may become even worse as you go up the hierarchy. Or it may you may make it, you may end it
by just staying where you are.
Staying where you are, doing other things, going to settings where you don't have to strain a lot. But again, as you're moving out as a doctor, medical internship is supervised, but as you're moving out as a doctor, the decisions are yours. You have a license to protect. You have a reputation to protect. People will ask, who are you? Which doctor is this one? From which university? Where? Had internship from where? People will start questioning your medical training if you move out there and start doing things unprofessionally. So
true.
You have a license to protect. So
I remember I met one of medical officers who was into forensics. So he decided to stay as a medical officer, but now he was doing medical reports and all for the police, and he was appearing in court and giving testimonies and all. He told me it's not everyone's cup of tea, because when you get into court and you sit there and you're giving your evidence, they percuss you in such a way that you feel like you're no longer a good doctor or something.
Yeah, it's a different story there. The law and medicine, it's a different thing. So, but all in all, make sure you adhere to your ethical principles, because even in forensics, they have their ethics that they follow and go by. So if you choose to go that route, it's also nice. You must have your laws here at your hands. You must have your medical ethics at your fingertips.
So then the next thing would be job prospects. In that, right now, what is the market like for medical officers? Is it easy to get a job, especially in these hospitals where
it's not private? Easy. It's not easy to get a job. Personally, after internship, we had to apply in so many hospitals, but out of so many hospitals, many of them would give you feedback, and the feedback would also not be good. Maybe telling you to wait or to come back some other time. No clarity. So it's obscure. Some of them that are really willing to take you, they want to use you. They want to exploit you.
Yeah.
Want to pay you less and then exploit you. Work a lot for them, and some of them will actually make you do dirty work just for money. Making you do wrong prescriptions.
Too many tests and all.
So many unnecessary things. Even surgery just for money. So it's not easy at all.
It's not easy.
That's why you find some people volunteering and
Trying to get a good way to
trying to
move forward.
get a way to move forward, or you find other people living along the medical aspect
Aspect, yeah.
as concentrating on other things. But again, if you really want to be someone, a doctor, a good doctor, keep practicing, keep updating your skills. So one of the things to really upgrade is to increase your value, or is to go back and fine tune your career and have some specialized training, go back for masters, uh, get something to upgrade. That's some people will go and start making their own clinics, drug shops to get money. Yeah, so still, that's another way someone will get people will get engaged in doing medical work. Others will apply. Of course, you apply so many times. Despite all these rejections, you do not stop because you never know what's coming for you. But again, do not be so desperate to be used, to be people will make you do dirty work. Do not go for that desperacy. Keep your skills, because now you'll do quackery somewhere, then they come for you. They come for your license. Much as you're making money, think about you.
Yeah, at the end of the day, the reputation is what matters.
The reputation
long
is
term to survive.
yours. Yes.
Because I remember one of our lecturers from medical school,
Yes.
he was giving us an advice. And he said that most of you guys come from families that are struggling and all, you have challenges. You
Yes.
might think that after you get your license, you might go around making
It's
a lot of money,
obvious.
solve everyone's problems. So you will not be able to manage that if you do it ethically. He told us that for the first 10 years, you have to build your reputation, you have to build a career, you have to first get people should know who you are.
Exactly.
After those 10 years is when you can actually go ahead and help the people who need you.
Yes. So building a name is not easy, because you have to do so many things, and it's time. It's time. You will not come out from nowhere, and you have to really impress so many people, do so much stuff, have so many records.
True. And with that, I wanted to bring you back to this topic. So, from medical school, me personally, I've noticed that you have given it your all every time. You have been studying all the time, you have done everything. You have kind of built your reputation over time. And you started this discussion sessions with us where we used to sit down all as a group and have topics that we could discuss and see and learn and teach each other. And eventually, you ended up starting a WhatsApp group for clinical cases. Could you tell us a little bit more about that WhatsApp group?
Yeah, it's called Clinical Cases. I'm not really the one who made it.
Okay.
It's Dr. Piriton. I don't know if you know him. Dr. James Mark.
Yes,
He's the one who made it.
He's very famous on YouTube.
Yes.
Yeah.
So it's good one. So he's the one who made the WhatsApp group, and it was made during the COVID period, because we were all not studying. We were all there confused. We don't know what's next. So in the COVID period, it was meant to continue for continuous learning. So it were posting cases, were posting guidelines, posting so many things, having fun generally, to make our mental health, to make our livelihood, to make our medical knowledge intact. Because during that COVID period, anything was bound to happen. People were sleeping and doing nothing. So they had to be excited a bit. So it was made during the COVID period, mainly to keep people busy, medical students busy. But it kept on growing, developing, and more people kept joining because they were benefiting.
True.
Yeah. So right now, they're not only medical students. We have doctors, we have nurses, we have
But
maybe
it's very educative because
yes,
they bring out the most unique cases that are around
yes,
in the field, and then they bring that on the group, and then they discuss. They
yes,
find out the unique signs for each diagnosis and all. So it's very enlightening.
yeah.
So there's another concern that most medical students have that I've seen, that they value CGPA a lot. At medical school, we were worried what our CGPA is falling, what should we do, how high should it be, all that. But at the same time, we see that after you get out of medical school, they don't really question much on the CGPA, and they question more on the skills you have, the
Mm.
services you can provide. So, what should medical students actually aim for? This is a big debate that's going on.
Well, as a doctor, like the way we are classified, our degree is not really classified because after passing medical school, after being declared a doctor, it's it's you're a doctor can be someone licensed to save life. So the only thing that is in the middle there is to complete your internship but CGPA, I would say personally, uh, there is where it matters.
True.
And there is where it doesn't matter. And sometimes you find someone with a high CGP, they apply for a job and they do not get it. Then you also find someone with a very low CGPA, they apply for a job and they get it. There are so many other factors that may be higher than the CGP. For example, your medical training, your internship, for example, or your skills. If you've been working with someone and they really know you and they know you're good, you're really good clinically. Your discipline is good. Your work ethics is good. Then, like you're someone who is passionate. You can be with a high CGP and you're not passionate about patient. They may not take you. So it depends on so many other factors. But again, having a good CGP is an added, really. It's really something that some people might look at because they look at it as our, I don't know how to phrase it, but
Competence
kind
in terms
of,
of knowledge.
yeah,
Like how much do you know?
like how much you know, how much like commitment.
Commit
I don't know how to
commitment.
phrase it, but again, it's like an added advantage because if you have high CGP, you're disciplined,
Yeah,
you
doing your work on
have
time.
compassion, then you're the best
True.
for that job. And again, for your future career, like for your, if you want to come back for MEd, there are some programs that do not take
Below a certain CGPA.
yeah. So if you want to pursue a particular, maybe a particular field,
Yeah.
some people may look at the
They might say
CGPA.
less than 3.6 not acceptable.
Uh-huh. Or like if they look at you and most of you have the same qualities, they may look at the
CGPA,
CGPA.
that's the last thing to look
That
at.
may be the last thing to look at. I don't know. But then if you can get it, get it.
So I think luck plays a big role here to some
Yes.
extent.
Yeah. Luck. I wouldn't say luck. Okay, maybe luck is there as well, but mentorship,
Mentorship.
knowing someone, having really having compassion
Compassion.
of on the things you do. I think it also matters. And then of course experience. That if you've been working like in for long, you have experience. You've been working like 2 years in emergency, like I've been working at Tutu, and then someone else, you're applying for some emergency work, and
I
someone has
understand.
just had 1 month or what. They may take this other person because they know.
They're more equipped.
Yeah, they're more equipped. They may need less
Training and less
training and
mentoring.
supervision, and doing other things like let alone I'd forgotten other things like getting other degrees besides medicine, added advantage,
can add another.
research,
True.
law, business.
Shows your complexity as a
Yes, it
human being.
shows like you are really multi-purpose.
You can do you can take over the thing and run the place if need be when
Yes,
time
so
comes.
it may be an added advantage. So
True.
I feel like you should aim for a good CGPA, nevertheless,
Nevertheless,
but you shouldn't rely on
on
it so
CGPA alone.
much for getting a job in the in the in the in the market out there.
True.
Mm.
Yeah, I think that brings us to the end of our discussion. If you have any other advice that you want to give to our viewers, we'd be happy to receive it.
So one of the things I would like to advise people who are in internship, coming for post-internship uh, journey is they should be prepared.
Okay.
They should be prepared. Much as you're doing internship there, you have a lot of things, you have a lot of patients to review. Think about your life during that period. Think about your life after an internship. Because immediately after internship, you're going to become confused. You're going to look at your friends, or your friends are going. Some of them are going out, others are going back to school, and you don't have anything. You're going to be that one will actually make matters worse because it will seem as if you're the one who is what. But again, follow your passion. Look for write your goals. Write down your goals exactly. Do not rush because you have time. You can even first relax and then write down your goals. Your goals should be short term and then long term. Make sure you write them down and how to strategize. If you don't have a goal, if you don't have purpose post internship, you're going to become so disappointed, so depressed. Hmm? Yes. If it's marriage, go for it. If you want to do USMLE, you want to practice out, start now. If you want, do not wait for internship to end and then you may wait for it to end, but at least make sure you have a purpose in post
You
internship
should have
period.
a plan and strategy
You should have
once
a
you're done with it.
plan, a strategy. Money, financial stability, where are you going to get? Because now you may not be relying on your parents anymore. So find a stable something that is going to put food on your table, something that is going
True,
to
true.
motivate you, something that is going to build your career. Do not stay stagnant in one place. Do not. Okay, you may be an MO, but make sure you also add on. Look, yeah, climb the ladder and uh, while you're still young, because when you grow old, it becomes hard.
True.
Mm,
Like the nephrologist I was working with, he was telling me make money as you're young. Because
yes.
once your kidneys stop working, then you will see what life will take you to.
Yeah, once your kidneys stop, you're gone.
Yeah. So that's very good advice. I think that has been insightful for us.
Mm.
And I hope our viewers and take this information and make it useful for them. And eventually we'll see how life moves on.
Yeah,
But but
yeah.
thank you for
All
coming,
will be
Dr. Tutu.
well. Thank
Thank
you
you
very
very much. We
much.
really appreciate you to be here. And yeah, we would congratulate you on your best performance as a doctor this year in Chirudu. And
Thank you very
hopefully
much.
we look forward to have a better future for you and for all of us. Thank you.
Thank you very much for having me. Thank you very much, viewers, for watching this channel, Med Scenario. I would like you to subscribe and get some insights into medical life, into the practice of medicine. It's one of the medical uh, YouTube channels that you benefit from as a Ugandan doctor, Ugandan medical student. It's a good initiative because it's going to help more in enlightening young doctors in removing fears they have for the medical practice, for medical school, for medical internship, and it will get you prepared for the worst that you can ever think of. But again, it's going to better your skills, it's going to better your mindset, and it's going to keep you updated in the world of medicine.